at the university and consultant at the Sleep Disorder Specialized Clinic, and I was asked by the scientific committee to talk about new diagnostic and therapeutic tools for obstructive sleep apnea. So during the next few minutes, I will be discussing the utility of home sleep study. We'll talk about new diagnostic modality and therapeutic modality for sleep apnea. Now, currently, what do we have when it comes to diagnostic? We have the full sleep study, which involved patients going to the lab and getting hooked with several signals to check their EEG, EMG, respiratory, as well as their ECG and heart rate. And we have the home sleep study. Now, we divide the type of studies into 4 as per the American Association of Sleep Medicine, type 1, which has a full sleep study attended by sleep technologists, and then the home sleep study, and the most popular one is type 3, which has 4 signals. Most of them are airflow, efforts, oximetry, and ECG. Now, what's new? Because I'm supposed to talk about what's new diagnostic. Now, talking about the full sleep study, what's new? Now, we do have evidence of using artificial intelligence in scoring the sleep studies. And one of the softwares which has really good evidence and publication is called Sleepware G3 with Somnolizer, which has really good validity, up to 80% comparing to manual scoring. So what do I think is going on in the future? So far, my technicians spent about home sleep study. A chin sensor that measures the mandibular movement to detect obstructive sleep apnea. This is really new, and it has just been approved by the FDA last month. Something really interesting, just one sensor on your chin. So what is about this? It's all about the mandibular movement, which comes with a measurement of the respiratory drive, and it's really rich of understanding of sleep, respiratory, and regulation. So that sensor, it has a gyroscope that measures the drive and amplitude, and it has an accelerometer that measures the position. And with this, there are some physiological changes, like a reduction of the respiratory muscle phase activity. There's a slight opening of the mouth during the obstructive sleep apnea, an increase in the upper airway resistance. And this is all can be measured with that sensor. And this is a really good example. Let's see if I have, yes, I have I don't know if you see it, but this is someone who's having a sleep apnea. What the sensor is showing that the patient during the obstructive sleep apnea, he's now opening his mouth, and then now he's having arousal. So with the arousal, he closes his mouth to open up the airway. And it can not only detect obstructive events, it can also detect central apnea. And again, it's all about, we're having 2 kinds of muscle, the depressor muscles, and then we have the open the jaw, and we have the elevator muscle, the masseter, if you remember the anatomy, that not only close the mouth, but also open the airway. And they have been having a very good, they published a really good article here that it showed a very good validity with accuracy of up to 92% for patients with obstructive sleep apnea, AHI of more than 5. So what do I think about the future? I think it would be most likely for portable sleep study as a very simple sensor in your jaw. Moving forward, what about if we would like, we still need to do a full sleep study, because there are patients with parasomnia, with narcolepsy, and currently my technician's spending 45 minutes, really getting every EEG in the right position. But this is another future technology. This future technology has also been just recently approved by the FDA, which basically it's based on a sensor in a batch. okay, where you would have just 3 batch, one a head sensor that will measure EEG, EOG, EMG, and oxygen saturation with one batch, another one in your chest that would get your respiratory effort as well as ECG, and then one in your legs that would look for leg movements. So with this, instead of spending like an hour putting all the leads, it's just like 4 batch. And this is again FDA approved. And then one more, which is yet now available, is the WatchPAT. And if you've seen the WatchPAT, is basically depending on the arterial vasodilator. So it's not looking at the parameter that we normally look at, the airflow and the chest movement, but it looks at the consequences of sleep apnea. And again, all what the physician has to do is set up the patient's account on his screen. The patient will download an application. He will use that portable home sleep study device. The data will be transmitted from the device to the patient mobile phone, to the cloud, to the physician, ready to be scored. And this is, again, another one which is being approved by FDA and available around. Now, questions that I always get from my patient, what about some of the consumer tracker, like a Fitbit? Everyone now is having an application. It could be an Apple Watch. How good are they in really measuring the sleep? And I found them very helpful. I'll show you some examples. There are studies on them. So for example, this is a recent study, actually April, so last month, evaluating predicting model of sleep apnea from smartphone recorded sleep breathing sounds. And it showed very good accuracy of 88%. Okay, and not only that, now we have an application, it's called NapBot for Apple Watch that can provide sleep apnea analysis in the new update. Again, these are not FDA approved, but this is really a good consumer that can get you more detailed sleep analysis, environmental sound, exposure, and sleep heart rate. How do I use this in my clinic? I have patients, let me give you an example of patients who came to me and showing me the result of his Fitbit during the night. And she was saying, doctor, why I'm waking up 3 or 4 times a night, despite that you're treating my sleep apnea? I said, okay, well, let's see your Fitbit and let me see. And it has something like this, where she had arousal at the middle of the night. I said, okay, let me download the data from your CPAP. What I found that exactly on these slots of time, she had air leakage, significant air leakage, where the Fitbit detected movement and arousal. So I said, okay, you know what? How old is your mask? Let's let's fit you with a new mask. So these consumer devices are really helpful along with your regular therapy. What else do we have now? The 360 smart bed, which is really smart bed because it can detect the patient sleep time, heart rate, breathing, snoring, and not only this, once you start snoring, it can adjust the bed accordingly to open up your airway. And many studies are now going on this, has been publications, especially in patients with cancer, where they need sometimes more improvement in quality of sleep. So I'm done with the diagnostic. I'm moving now to therapeutic. So therapeutic, as you know, CPAP is the gold standard when it comes to treatment. Well, what's new? Now, the new is getting the data from the device to the patient, to the physician dashboard, where the physician can sit and review all his patients. There will be a flag. If the patient is not using it, he can adjust the treatment if needed. So these are all about integration from the device vendors to the therapist, to the physician, to the sleep lab with one platform. And this is starting now. maybe not yet integrated, but it's coming soon to the UAE. We had an issue last year with the communication authority not allowing this because data will be stored somewhere else, but now has been fixed. Most of the data will be stored in UAE. Amazon is opening up here in UAE cloud services. So ResMed, Fisher & Paykel, Philips will have the services hopefully by the end of the year. So what other treatments do we have for sleep apnea? Rather than the CPAP, we have the mandibular advanced therapy. Now, what's new about this? The new is while you're in your clinic, you don't have to send the patient for dentist. There's now a scanner that can scan the patient's mouth. It's sent it directly to the manufacturer, who could be, in this case, in Canada. They will make up the oral device for that patient, ship it to you, and the patients can use it. Now, this is not all. Now, people are asking, well, how can you make sure that the patient is using the device? Now it comes with a tracker. That tracker is a small chip that you can track the patient usage and efficacy. So just like your CPAP, when you download the data, you got a tracker there for your oral mandibular device. What else? What's new? Well, we have the hypoglossal nerve stimulation, which basically has a stimulation lead, a generator, and a breathing sensor. And with this, a very popular one, which has been approved by the FDA, is Inspire. Let's see. Now, there was a video here. Maybe if you click, there's a video. This is, again, last month. When I say new, this is new FDA approved. Can you click on the video? This is Genio, another. Can you click? There's a video. I think they're sleeping there. If you click on the YouTube. Yes, thank you. There's a sound. Well, I can explain it, but basically, unlike what you see with the hypoglossal nerve stimulation, this is much more easier. Has been just approved by FDA, where they require a sensor with just one in the oral cavity, and the battery is outside. So what does the patient do in the evening? He will attach the battery and the generator every night, and it starts working. Unlike the other one, which I showed you, that has to have a generator in the chest, a sensor in the chest to check the negative intrathoracic pressure. This is much more even easier. You can just go in, get his information to the website, see a doctor, and implant it easily. Okay, let's go next. So yeah, very easy to use. We'll charge it every day, and at night he'll just apply the patch and start working. I'll stop in here. I'd like to thank you again for spending the whole day toward listening to